case you're wondering how experienced I am, boom. Okay, I'm going to rush through this, but I'm not amazing with a time limit. My name's Robbie. I'm a registered nurse from Sydney. I work a lot in general practice and sexual health, and welcome to my side hustle. My whole life is side hustle, as I discovered listening to Lou's presentation. Basically, I'm going to talk to you very quickly about building an online profile, what that might look like and who it's right for, and trying to use social media to expand your career and whatever that might mean. All right, so these are sort of the two things I'm going to very quickly talk about. Building an online profile, either for yourself, sort of creating for a presence for yourself, or if you work in a practice and you think your practice is doing great things, actually just building a presence online for your practice and the benefit that that can give you as a team and your patients as well. I'll talk about who it's right for, because it isn't right for some people. And I sort of have always said I don't expect that everybody should be on social media or should be experts about it, or that it's perfect or fun for everyone. But I think just having a good understanding of it, because statistically a giant proportion of the world is engaging with it as a communication platform. So just having a good or a base understanding of it. And then I'm going to try to whip through using social media to expand your career and all the different things that that can look like. Personal brand, research, networking. There is so much you can do with it. I am a shameless, I was going to say a really bad swear word. I am shameless on social media for just reaching out and contacting people who I have like no business networking with, but just kind of pushing myself in and creating opportunities. One very, very quick word. I want to start and end with a piece of advice. Social media is an amazing resource for healthcare, but it takes time. And so if you don't feel like you have the time to give to using social media, don't do it, because your experience of it will be very negative and it will make you very resentful of the platform for engaging with it for yourself in the future, but also when patients tell you that they're using it to look up health or find resources or information and you've had a really negative experience because you didn't have the time for it, you might tarnish that for them as well. So that's fine if you don't have the time to do it, just wait until you do. And then I also want to say, if you are using social media at work, you're building a presence for your practice, you're creating a Facebook page, make sure that there is time rostered for that, and preferably, if you had a practice manager like Patrice, who is amazing, make sure there is pay rostered for that as well. Because this is a whole new duty that you are taking on. It's a whole new task that you're doing, and you should be sort of recognized and compensated for that. Again, otherwise it will build resentment. Good Lord, I have a lot of notes written here, oh my God. Okay, so building an online profile, what does that look like? I would split that into two different areas. If you're building an online profile or presence for yourself, is it for a one-off purpose, like job hunting? Or is it for an ongoing reason, like creating a brand or trying to turn yourself into a thought leader about a particular area of healthcare? And so when you try to figure that out, you really need to create a strategy for why you're using social media. Otherwise, your efforts won't be fruitful and nothing will come back to you. So you need a strategy at the heart of why you've decided to engage with this platform. And a strategy is literally one sentence. And it is one sentence that you write out and then you keep coming back to make sure that every single decision that you make about using social media reflects that strategy. So my strategy might be improve health literacy and advocate for primary healthcare nursing. So easy. One sentence, and that way every single post that I do, if I go, does that reflect that strategy? No, don't post it. Otherwise, you're going to confuse your audience, because if you're using social media to try to get a job and you're posting a million photos of your cat, that's going to confuse recruiters, and that's going to confuse the audience that you're trying to engage with. So seriously, if it's something that you want to do, just write out a one-sentence strategy, even if it's for your workplace as well. So if you are doing it for a single purpose, I would say like job hunting, as Lou thankfully spoke about for me, LinkedIn is probably a great way to do that. LinkedIn is very user-friendly. It's just like professional Facebook. So you're going to share resources, articles, you're going to have a nice professional photo of yourself. You get to write your own bio. You get to insert all of your job description. And even if the way it generates a CV is not amazing, on the CV that you write for yourself, just put the link to your LinkedIn page. So that then if there's extra stuff that doesn't fit on the nice looking one page you give over to an employer, they can click on that profile and you've directed them to the social media platform you want them to engage with, rather than them Googling you and all sorts of awful things coming up. And if you're going to create an online presence for yourself, personally, I think the best platforms would be either Facebook, Instagram, or Twitter. I actually think is the best one for healthcare workers. And you should research your demographics. So the Census Social Media Report, I think it's called, is a really, really, really great place to start. It is Australian specific, and it tells you what types of demographics are using what types of social media and how they're engaging with it. And so if you know there's a population that you really want to hit, I would very much encourage you to look up the Census Social Media Report. Oh my God. Wrap me up because I love a chat. Building an online profile for your practice. This, I think, is something that is starting to expand and I think can have really, really, really wonderful benefits. Really, really simple activity to engage with social media and to show that your patients that you understand the platform that they are engaging with and to communicate, which is building a Facebook page for your practice. There's lots of reasons you might do that. You might advertise some of your services that your community might not know that you do. Maybe you do a certain kind of vaccine clinic, a nurse-led clinic. Maybe you sort of run STI testing that the community never would have thought to bring up. It's sort of a passive way of making people care about certain issues of their health that they might not bring up in a consult or you might not know how to bring up in a consult. You can share resources with patients. I think we all know that the big downside of Dr. Google is that people can just find literally anything online because anybody can build a website and say whatever they want. And so you can actually direct people to good quality resources. By having a Facebook page that all of your patients have engaged with, you can share articles, share resources, and show them what good credible evidence looks like. Very, very good, simple one. You can share updates about the clinic. Hey everyone, did you know that X is on holiday until X? And so that way you're not going to have a million people calling up and bothering the already very busy reception staff being like, I need to book in with this person, because they know that they're already on holiday. But most importantly, I think creating an online presence for your practice really fosters community. I think it was the Census Social Media Report, basically shows that consumers are more likely to respect, trust, and come back to any kind of business with positive engagement on social media. So if you have a really nice, warm Facebook page where people can write to you or at least write comments, or you're sharing articles and they go, that was great, and you write back to them in a positive, friendly way, you're actually creating and fostering community with them because it's sort of the new big way that we all communicate with each other. And so you're either going to increase patient retention, you're just going to make people feel good, you're going to make people very trusting of the centre as well. Facebook, I think, is the sort of best and only platform if you're trying to build community for your business. I wouldn't bother creating an Instagram page for your clinic or a Twitter account for your clinic because that's better sort of for an individual use. And then just a very quick little tip would be, has anyone ever heard of SourceBottle? Oh my gosh, SourceBottle is amazing if you ever want to get in touch with journalists. Journalists are constantly looking for comment and content on things, and they constantly need experts to speak about things and give comment. So SourceBottle is a way to link experts who have no idea about how to get in touch with journalists with journalists. A journalist will put something out being like, oh my gosh, I'm writing an article on this and I need a nurse who's really good at child and family health to speak on it. And then you click on that and you go, I think I'd be great. And then you provide the expert comment in that article. And this can be really great if you work in a practice with a really diverse range of specialties. And you can start to sort of put your business on the map a little bit, show people that you're a community that can be trusted, and just sort of get your clinic's name out there. I think I was meant to wrap up like 30 seconds ago. Is that about right? All right, so just a few very, very, very quick tips. The main tip that I want to tell everyone is get on Twitter. I know that sounds like such an awful millennial thing to say, but Twitter is awful. It is arguably the best platform for anybody who works in health, and I always say Twitter keeps me evidence-based. And what I mean by that is, do you know who's really, really amazing at using Twitter? Because it's not nurses, it's academics. It's people who are doing research, are excellent at using Twitter and sharing their evidence on Twitter as well. So very often I'll be sitting at work being like, oh, I know that policy's changed. I know there's some kind of research that came out about that. Why don't I need to use alcohol swabs again if I'm doing vaccines? I will send that question out to Twitter, and very, very helpful people will just, who I don't know, will write back and go, oh yeah, here's that article. Here's this, here's that. You engage with it, you see it's evidence-based, and everyone sort of, this community wants to help each other be the best and do the best evidence-based practice that we can. Twitter's also amazing for networking because you can be very shameless. There are two very incredible academics from the University of New England sitting on that table over there who I had never met in person, but if you saw me with them today, would think they were old friends because I shamelessly just reached out to them and was like, you guys are doing amazing work. We talk all the time via Twitter. We hopefully we'll get to work together. It's really, really excellent for reaching out and touching base with people that you might not have the opportunity to because they're doing something cool like you are, but they live in a different state or a different territory, or you just don't have a chance to meet with them, or you couldn't attend the conference. Social media is great because you can practice writing your own content, you can release articles, have your peers review it, you can build online communities like journal clubs, you can create a Facebook page for nurses in your region so you can share stories to avoid creating burnout. Oh my God, I talk about this for so long. This is actually what I'm going to end on, and I know we sort of don't really even have time for questions after this, but if you see me just floating around, because I will be here, please just find me, ask me questions, that's absolutely fine. If you're going to engage in social media, build a social media strategy. This is really vital to creating a presence that doesn't feel erratic, looks professional, and you get your biggest bang for buck. So instead of just being like, oh yeah, that'd be good, I'm going to post about that. Oh yeah, oh my gosh, it's International Nurses Day, I didn't even think to write a post about that. What you literally do at the start of every week, you should see my office at home is just like whiteboards, and one of them is a weekly calendar where I write what I'm going to post on my social media pages on those days if I'm going to, and then I don't have to think about it anymore. I could spend an hour on a Sunday writing out each post in advance, and then I just have to share it at the right time. And it actually takes away a lot of that stress, stops it looking really erratic. And this is kind of literally an example taken from my whiteboard before I got here this week. I wrote my Monday, Tuesday, Wednesday, Thursday, Friday, and what I was going to do on the weekend. I think I hit all of those as well, which is cool. So I would say shamelessly steal this, especially if it's something that you're going to be doing for work, because you can condense what would have been 5 days worth of work into just 1 hour of deciding what you're going to write out. Yeah, if you're lost, reach out. Here I am. What makes me an expert on this, you might ask? Don't ask that question. I don't know. Don't ask it. Yeah, how we use it professionally is very different to how we use it personally. It can be like a whole different language, navigating social media as a professional as opposed to a person. If you're lost, that's fine. Don't rush into it. Reach out to people who you think are doing it well. This sounds very narcissistic, but a really great place to start would be not with me, but to look at my social media channels and look at who I follow, because these are all people who are doing it really, really well, and I sort of like stand on the shoulders of giants and try to model off what it is that they are doing. And there are consultants who work in this space that you can hire as well to become social media savvy. If you're a practice manager, you could even run an in-service for your staff on how to become social media savvy as well. I say not as a practice manager, having no idea how much that would cost. And on that, which is ironic because when Patrice talked about the person who like gives out 1 million dressings at the end of a consult, that is me. They're like, oh, I spent all my money on this like Louis Vuitton bag, and I was like, I'll stuff it with dressings for you. You're good. Sorry. Anyway, I will be here. I'm around. So if you have any questions about using social media, you can either ask me in person or find me on social media, and I will respond. Thanks very much.